A new survey has revealed that while COVID restrictions may be in the past, the mental strain the pandemic and those restrictions has had on young students continues to be an issue. On the surface, it appears students, in this case those in high school, are doing better when it comes to their mental health now that in-person learning and extracurriculars have returned.
I get to see my friends.
It's better because I get to go to school in person, see everybody.
I just appreciate everything a lot more back in school, like everything school offers, friends, social life. It's just better now.
It's good. I think that like at home in COVID, it was definitely worse because you didn't get to see anyone, but like now that you're at school, it's better.
However, the group People for Education, a not-for-profit that advocates for public schools, says a recent survey they conducted involving principals from across Ontario paints a very different picture.
They're seeing a lot of behavioral issues, kids with mental health challenges or difficulty kind of regulating themselves. And the vast majority of them, 90% of them, 91%, said they needed some or more support.
The study shows that 61% of students 12 to 17 years old are reporting good mental health, but that's a drop of 12 points from before COVID entered our lives. And the president of the Elementary Teachers Federation of Ontario says that drop is playing out in classrooms.
A rise in violence in schools because there's a lack of the ability to access testing. There isn't any supports for intervention. And then once the children are assessed, where are the supports to support them to be successful?
In addition, Toronto Public Health reporting a 30% spike in emergency visits related to self-harm. Both Karen Brown and Annie Kidder say more needs to be done to boost mental health infrastructure in schools.
Many schools don't have a guidance counselor. Only 18% of the schools actually have that. So your school might not, your guidance counselor might be sharing between schools.
It might look like more kind of wraparound services around schools so that it's easier to access those kind of community health centers where maybe there's a social worker or a mental health specialist. And it looks like more support for staff so that people inside school who are educators and not necessarily trained, certainly not to treat mental illness, that there's enough staff in school so that we're not left in this situation. One principal called it a downward spiral.
The agency is also calling on the province to offer more family and community support and to realize and accept that the pandemic and its restrictions were very difficult for students.